My name is Kevin Cirilli. I'm the Chief Washington Correspondent for Bloomberg Television and for Bloomberg Radio. I'm joined now by Dr. Deborah Birx. She is the Coronavirus Response Coordinator at the U.S. State Department. Dr. Birx, thank you for joining us. And I have to ask, how have the events over the past week impacted your ability and your team's ability to do your jobs?
Well, I mean, the most important thing is we're focused on the virus all the time. But of course, any kind of disruption like this that really pushes people to the limit, increases more anxiety, is difficult for everyone, difficult for Americans here and difficult for Americans around the globe. We've tried to stay very focused on working with the states to really combat the virus, but I think it was a shock to everyone.
And as you look forward in terms of vaccine distribution, Dr. Birx, where are we right now on the vaccination front and making sure that every American can get a vaccine?
Well, it's really a really important question right now because I know you can see what's happening. The really explosion of cases that we saw in the Northern Plains states and the Rocky Mountain states in the September-October timeframe has moved into the more populous states of California and across the Sun Belt into Florida, Georgia, South Carolina, North Carolina, Kentucky, Tennessee. And this is really a very important time that states both increase their mitigation because the rate of spread is much higher with this current fall surge into winter surge. And vaccination and ensuring vaccination, both of our frontline healthcare workers, but also particularly vulnerable Americans over 65 will be essential. And we can see now certain states are having great success in moving forward. We see West Virginia really immunizing almost 6 to 7% of their adult population. Focused on really the vulnerable individuals as well as healthcare workers. But we also see a really good healthcare worker immunization program in North and South Dakota. So we're trying to bring all of that information together really from the operational aspects in the field and get that out to all governors so they can learn from one another.
What are some states that and I don't really want to politicize this, but what are some states that are struggling right now or that are in the middle of reversing course, so to speak, to follow states that have cracked the code, for lack of a better phrase, to get folks immunized?
Well, first, I think it's really difficult right now for governors and health officials around the United States. This virus is moving very rapidly. The rapid acquisition of cases that we're seeing results in this rapid uptick in hospitalizations. So they're working on combating the virus through mitigation and talking to their state residents and trying to get mitigation of washing your hands, physical distancing, wearing masks, at the same time that they're trying to immunize individuals. So we can see across the South that there's been less vaccinations at the same time they're confronting this virus. And so it's our job to really work with each one of these states and really, and I know right now CDC is working very closely with Georgia to really help them get over some of these structural barriers that we know always occur when we're implementing new programs.
Dr. Birx, as we move into a new month, a new year, should Americans feel optimistic about the course that we are on with the vaccination front?
You know, it's difficult to be completely optimistic. I'm optimistic about the vaccines if we can get them into the arms of people who need them the most, as well as our frontline healthcare providers. But when you look at what's happening with cases, hospitalizations, and our fatality rates, we need to increase our diligence right now over these next 4 to 6 weeks will be very critical. We need to protect one another in new ways because the things that we did in the summer are not working to the same extent that they did in the summer when we were able to mitigate. So we're really asking people to double down on mitigation while we work together to get people immunized.
Why is that? Do we know? Why is it that that's not working, but it did in the summer?
You know, it's a really great question. Obviously, weather conditions play a role, people moving indoors playing a role, the multiple holidays are playing a role, but also, you know, we're very concerned that the virus is just moving through the population in a different way. And so really asking people to do more than what they did in the spring and the summer personally to really protect each other and their families. Our goal right now that we have vaccines are out in the states, to really make sure that we can get our vulnerable Americans immunized, asking everybody to really protect one another right now while vaccines become available.
Is it realistic for most Americans to expect to receive the vaccine by the first quarter or by the first half of this year?
I think what's really important is we get those that we know are very vulnerable to serious disease, those with comorbidities. CDC just added Down syndromes to those difficult and concerning comorbidities. So really making sure the vulnerable Americans are immunized. The rest of us are going to wait our turn. I'm not in any of those frontline categories, so I'm going to wait my turn, but I do hope my parents at 91 and 96 get immunized. And I think those are the sacrifices we're all going to have to make as Americans, wearing our masks, physical distancing, and keeping our place in line to ensure that those who need it the most get immunized.
Dr. Birx, you have said that you are going to retire at the end of this term. As you look back on your career, which spans decades, and the work that you've done on HIV and AIDS and whatnot, but in particular, what is your biggest regret for the past year in the midst of this pandemic that you wish you could have corrected or done over?
Well, thank you for that question. And what I really said is I would retire after it was clear that the Biden administration had everything they needed, whether that's next month, February, March, or April, that's what it will be. I will return to my home agency, but I certainly want to make sure that the incoming administration is extraordinarily successful. I think this last year, what I learned from going out to states was absolutely crucial. And I wish I had done it in April, because it really changed how we thought about the virus, the policies that we worked with states on, and really the importance of communication at that state level, and really understanding what was making people more vulnerable, from the tribal nations to our inner city African American and Hispanic groups, to really understand how we had to surge testing in a strategic way and in a new way. So what I learned in the field going to 44 states and to universities was really essential. It taught us a lot to be on the ground. And I think when many people weren't traveling, that really became critical to understand what governors, what the health individuals were confronting, talking to hospitals and really understanding, and then hearing what communities said and really listening. And that was really critical. And I wish I had gone out towards the end of April.
And I had to follow up, and I have other questions, but to follow up on this, policymakers of all political stripes, yourself included, have received some criticism for what has been not following some of the guidelines that have been put out there. What have you learned from that experience, Dr. Birx, and that you hope policymakers of all political stripes recognize that people are watching, people are listening to what people like yourselves are telling the public to do?
Yeah, first and foremost, what has kept me safe in the 6 months I've been in the field, I think 80, 90 days, nearly 30,000 miles, was following the CDC guidelines. Those CDC guidelines were our lifeline, and we followed them every day. I really regret how this story was reported. My household has been part of my household for the last many, many decades. And I did have to support my household in Potomac. I have not gathered, and I still haven't gathered. We have 4 children. I've seen one of them. It's part of that bubble household that I'm a part of. All Americans are making sacrifices. Grandparents are not seeing grandchildren. My parents haven't seen my brother or their grandchildren in over a year. I know Americans are making those sacrifices. We're all making those sacrifices together, and all of us need to continue those sacrifices until everyone is immunized.
How do you hope to be remembered, and how do you hope this team is remembered once America finally turns the corner from COVID-19?
Well, I think, for the last 11 months, I've never made this about me, because that's not what it's about. It's about how, as an administration, as a federal government, we work to support the states, to support the residents of those states. And I think what I know will be true is this will be a historic event that people look at very carefully. There is a written record. People will be able to see what went well, what needs to improve next time. I think I've kept very clear notes on my recommendations of how we need to be prepared for the next pandemic. There's some legislative fixes, but there's some really how our systems work or don't work together that really need to be addressed. And I really hope that sometimes when we get through a crisis, we don't want to fix the things because we've moved past that crisis. I think this will be the moment that we really need to address issues that exist, both from health disparities, but also legislative fixes that will be critical for us to be able to have data and accessibility of data in the future.
Two more questions very quickly. First and foremost, what's a memory of the past 11 months that really captures on the front lines as you've traveled the entire country and 44 states, I believe you said? What's a memory that and I know there's so many, but one's coming to your mind right now as I'm asking this question, of a frontline incident that gives you hope, that gives you optimism, that it illustrates the American spirit?
I think no matter where I went, and no matter whether it was a local county commissioner to a mayor to a governor to tribal leader chairmen, they all shared the fact that they wanted to protect the people that they were responsible for leading. And I think that's what gives me incredible hope. It gave me incredible hope the whole time I was traveling, is the level of dedication of our local leaders throughout the United States.
And then finally, what's one thing that's kept you going? Maybe it's not. Maybe, what's one thing that's kept you going besides, it could be very practical, like coffee?
The mission. Those who know me, I am relentless in completing and working on the mission. And the mission was to try to decrease the impact of COVID-19. And we still need, and that mission is still mission essential over these next few months.